think one of the biggest issues is all about access. It's clearly discovering a drug is a difficult thing and a very lengthy process to get there. Registering it is also equally challenging. But once it's got it registered, I think the whole community feels in many ways frustrated by the time it takes to get access by the patients who need these medicines to the drugs and interventions that have already been registered. I'd say that's the biggest single issue right now. It's also not so much that mechanisms don't exist, but the time it can take to navigate through them. Biggest challenges for me over the next 12 months, we've actually got a focus on 4 core areas right now in the sort of clinical or marketed area. So we have marketed products for pulmonary arterial hypertension. We're also expecting to file our first gene therapy, ex vivo gene therapy medicine next year. And we have some important clinical data ongoing for ALS as well as familial amyloidosis. So I've got a pretty packed year next year in many different angles. And quite honestly for me, and for a company like GSK where we aren't a single category focused company, it's being able to manage the breadth of all of the challenges that those things bring at the same time as actually trying to build a business for the future as well. I've come here really to learn. You can't learn anything about rare diseases sitting behind a desk, so I think it's great to network with people who are in areas that overlap with where we are, or they may have solutions that we're looking for. And it's a very small community, so it's great to start building those connections and relationships because I think this whole world is about collaboration.